Hey, everybody, I'm here today with Dr. Eric Gordon for a very special Tick Bootcamp podcast episode. We had the honor of meeting Dr. Gordon in New York City for Project Lab Coat. And in fact, we walked the catwalk together to raise awareness for Lyme disease. And it was an absolutely fantastic experience. We raised a ton of money and it even made international news. So, Dr. Gordon, welcome to the Tick Bootcamp podcast.
Thanks, Matt. Pleasure to be here. Eric is really a better way to call me too. I answer better.
I was telling you offline, Dr. Gordon, that if we refer to doctors or researchers by their first name, we get yelled at by our listeners. So
Oh,
we will,
okay.
we will never do that again. So we made that
Oh,
mistake when somebody told us to call them by their first name. So, we're going to show you the respect that you deserve, especially
oh,
as a Lyme literate medical doctor helping so many Lyme patients.
well, thank you, thank you, thank you. Yeah, Lyme. Yes.
Well, we do want to. So if you can quickly introduce yourself, because I want to go back to life before being a leading Lyme doctor. But before we go there, can you just give us a high level overview of who you are, what you do, and where you're located?
Okay. Let's see. I've, yeah, I've been a doctor for 45 years now, and I always had wanted. I started out wanting to learn how to keep people healthy. Okay, but when I went to medical school, I realized that I wasn't being taught that, and I got seduced by treating sick people. And it's very satisfying, especially if they get well. And but I never gave up my dream of I always looked for like how what keeps people well, what's the difference in people, because it's easy to treat the pneumonia, but then some people are back to life in 3 weeks, some people in 6 weeks, and some people 6 months later were still not popping back. And they always intrigued me, like what were we missing? What were we doing wrong? And and then, of course, being a doctor in upstate New York, this was back in the 80s. We had lots of people, well, not lots, but we had a few people who like didn't fit any mold. They just didn't feel well. And Lyme was not on the table then because we were taught that there was no Lyme north of the Catskills. Which,
Simply not true, but not yes. But
when
some people still believe that.
no, but I mean, like that's just such an absurd concept that, like, like okay, we got plenty of deer, why is there and plenty of mice? Why is there no ticks? Ticks aren't that sensitive to temperature, and anyway, but I started to get more. I always believe my patients. I think that's one of the things that people have to understand. And I'm not really answering your first question completely, but I'll get to it. But
Yeah.
because this is the biggest frustration for patients, and I think it's so important for them to understand that doctors unfortunately get a lot of their early training in ERs. And especially if you're in a large city where in that population there are a lot of very sick people, a lot of people with trauma, with injuries, and there are a lot of people who, because of our economic system, are just, trying to get by and need an excuse for work or, are drug seeking, all these things. And so when you're a young physician, you're exposed to this, and a lot of these people are maybe not lying, but embellishing, and so you get taught by the we call the attendings, the senior doctors, to like, be wary of this, so you learn to become a detective and you learn to kind of mistrust, which is a terrible thing because when you get into practice and you see, everyday folks in your office, it's unusual to find people who lie to you. I mean, there still are people who maybe were drug seekers or, they're trying to game the system. But, just like life, the vast majority of people are honest, good folks who are coming to have for help. But that way of interrogating and the way of looking, and in the ER, you're looking for clear-cut disease. And especially now, if you go into an ER, the young docs, I mean, they're brilliant if you're bleeding out, or you have a heart attack or a stroke. But if you don't feel well, they don't really have time for you because you don't fit any of their algorithms. You don't fit. And so that's where patients get so frustrated because they're not listened to and they're not believed. And especially if you have something in that world of, unfortunately, of like Lyme disease, or any of the tick-borne infections or chronic fatigue, long COVID, you have multiple complaints that don't, um, that don't fit the algorithm for disease. Okay, because you complain that you're fatigued, but your blood count is normal, your thyroid function is normal. So, what's your problem? You're just depressed, and that's what people go through. So I always believe patients, and that got me to listen to them and listen to their stories. And because I had always been interested in health, typical, in the 70s, late 60s, early 70s, I was, working in health food stores and, thinking I was going to find the right diet for people. Another big hole, unanswerable thing, because I mean, there are right diets, but they depend on your background and your biochemistry. Um, so, I kept did regular medicine. In about 1992, I studied osteopathy for a year, and then I went off on my own to just treat people who had complaints that didn't make sense. But I still wasn't treating Lyme, okay?
So
Because
real quick, Dr. Gordon. So you always had an interest in medicine. It sounds
oh,
like you were working in the medical space, right?
hmm.
And diet supplements, and then you went to school to become a doctor. Quickly became a doctor, and then branched off to open up your own
Yeah,
clinic. Is that
actually
true?
pretty quickly. Because it was the first 10, 12 years, I went down the rabbit hole of like being like, the internal medicine world, even though I worked as a family practitioner, but I worked in internal medicine in a small hospital where we did all the stuff. So I fell into that world of disease and how f fulfilling it is to treat acute disease. Okay,
Right.
because acute disease you treat and people get better, and it's really very satisfying. But then, like I said, when you start listening to people who are the ones who don't get better, it's less satisfying because as a conventional doctor, all you have is try a different drug, which drugs are band-aids. Drugs are things that really are wonderful, but they fulfill a very short-term process. They like cover a symptom, they give your body chance to recover. Okay, they stop a they often interfere with a pathway that is not knowing how to turn itself off. So you're like quieting down inflammation, you're lowering blood pressure, you're lowering blood sugar, you're doing all those good things, but they're not good things chronically. They're good things in the moment, but then you have to go back and say, what's wrong with the physiology? And that is where medicine has fallen down. It hasn't really been able to use its brain power. It's still, we've fallen in love with our weapons, so to speak. We have pharmaceuticals, and they're very good at suppressing symptoms. And that's where we stay today. All the autoimmune diseases, we've got a ton of biologics that interfere with pieces of the inflammatory process that will restore patients. Well, they'll get rid of symptoms, but they're not dealing with what's underneath. So then when you start dealing with and looking for chronic infections, because we are really good at acute infections, but the idea that people had these infections that were low grade and persisted, we knew about tuberculosis and leprosy and
Yeah.
a few other chronic illnesses, but we acted like those were special and almost exceptions. What we thought about was like, acute pneumonias or acute gallbladder infections or stomach infections or intestinal infections that you treat and then they go away within a few weeks. And the idea that you can have bugs that persist for years and live in the body is not something that doctors like to think about. It's just a matter of thought process.
Dr.
So,
Gordon, real quick, I want to question you on one thing you just said, because I couldn't agree more that acute medicine is different than chronic care, right? And chronic illnesses like persistent infections. But you said something really powerful, and I like the way you said it. You said that drugs give the body a chance to recover, right? And we've had a lot of doctors on this podcast and a lot of researchers and a lot of patients with very strong opinions on two sides of this argument. The first side of the argument is you shouldn't be taking drugs. Chronic Lyme is a chronic illness. You should be getting to the root and rebuilding the body, restoring the immune system, removing the mold, removing all the various opportunistic viruses, that should be a natural approach. And others say, hey, look, I wouldn't have been able to do that if it weren't for the drugs that helped me suppress my symptoms while I was addressing the root cause as well. Where do you fall on that spectrum? Because there are two sides to that and very strong opinionated sides as far as where drugs play a role, if any, in the chronic Lyme space.
And again, it just depends on the patient because I do both. I mean, my practice, there's two MDs and I think what are it, five naturopaths. Okay. And we kind of we have a very long, we have a spectrum,
Yep.
one of the doctors that works with me is Dr. Steve Harris, who's now president of iLabs. And, I mean, yeah, and Steve, Steve, like, Steve is a real expert in the drugs, in the antibiotics for Lyme disease, but he also, because he's learned the limitations of that, is spends a lot of time working on the more naturopathic side of the world. And it's the same thing for the naturopaths. Most of them, they some of them use a little bit of drugs, some of them use a lot of drugs, but we all believe that you have to restore the terrain. You have to get the
Yep.
body to do the final healing. Now, again, with acute Lyme disease, you can get away with, your 3 to 6 weeks, 4 weeks, whatever, of antibiotics, and whew, people are better. And occasionally we have people who come in who've been sick for 2 or 3 years, and or sometimes even longer, and you're lucky you use antibiotics and poof, they get better. But that's not the patients that I tend to see anymore.
Yep.
Generally, the people we see are the people who've been sick for 3 to 20 years, and that route isn't going to work because the body, once you've had inflammation for a long time, okay, the compensations that your body has done to coexist with the bug, okay, and the effects of chronic inflammation on the gut and how the things that the gut absorbs and what the liver now has to do leaves you in a place where um, just just killing the bugs doesn't help, and B, your body often cannot tolerate the increased inflammation that happens when you just try to kill the bugs, right off. So it's not, it shouldn't be an either or argument. It has to really be, depends on the patient, because there are people who respond beautifully to herbs and some of the energetic things, and that's wonderful. But there are other people who their systems just don't seem to respond well to that. And so, at some point, drugs, usually antibiotics, do help. When we get into these religious arguments, which I call them religious arguments,
Yeah.
we lose the sight of that it's the individual, okay? Um, and that's what's made such a mess because the we become, like the polarization, I don't think is ever a good idea. Now, I shouldn't say it, but on the other hand, the true believers, the people who just believe that it should only be herbs, and the people who are just, restoring the terrain and then the body's going to heal itself, or the people who just believe that it should be, oh, if I find the right drug, we're going to quiet your system down and then your body's going to heal. These are all correct sometimes. And the beauty of life is that we need all those true believers because actually I learn from them, because the people who like will just use herbs get very, very good at the herbs and often develop combinations of herbs that turn out to be really good. And if they had been polluted, not polluted, but if they had been like, also using antibiotics, they probably wouldn't have gotten that good with the herbs. So it's not that they're wrong or bad. It's just the trick for the patient is to, first of all, understand your own body and try not to, and to, some people just resonate with with Western medicine. They just want, okay, give me the medicines and I'll take them, and and some people come in and like, God forbid, don't come near me with a drug. And that has to be respected in the beginning. But then you'll find, if a patient is willing to sometimes, you know, I will always want people to hold on to their own intuition.
Yeah.
Okay, they have a deep sense of what's right for them. And I think that's the first thing that has to be honored. But if you keep walking into the wall, following your intuition, you have to acknowledge that sometimes it's not perfect, and
Right. But I think you said something that I don't want to lose sight of as well, because look, everybody knows we express our opinions on this podcast. And Rich and I have come to the conclusion that the people that have the most success that we've interviewed from the patient community are the ones who are open-minded to try natural and pharmaceutical and also try some drugs to help them calm the symptoms while they're trying to get to the root cause. Because some of these symptoms are so inflammatory, are so, nervous system dysregulating. And if you don't have a clear mind, you can't make sound decisions and it's going to inhibit your healing. So you have to balance, the symptom relief of the drug, but also the negative effect of not getting the symptom relief to the patient's mental health and nervous system health, right? And there's a balance there. So I think, we've always come to the conclusion that it really is sometimes going to be personalized. Maybe I'll react better to herbs, you'll react better to pharmaceuticals, and maybe sometimes it's a hybrid somewhere in the middle. But I never thought about it from the perspective of the religious ones, who are the ones who say herbs only or drugs only, are the ones who get us the best research and conclusions in that particular niche area, which is so true, right? The diehard herbalists are the ones who are getting us the best herbal research for Lyme. The diehard drug advocates are the ones getting us the best drug treatments for Lyme. And we see that with all these research studies coming out of the past couple of years, right? All these new drugs that are candidates to treat Lyme that are reusing existing antibiotics, right? Wouldn't have happened if it weren't for the diehard drug, advocates. So I think that's a really valid point. But I think we have to be open-minded to that, but also understand that if we're going down a path and we're set on herbs, we're not getting where we need to be, we have to be open-minded to pivot. Otherwise, we're going to inhibit our own healing. And I think that's the message I've heard from you, which I couldn't agree more with.
and the thing you have to remember is that, in this day and age when, because there's always been, people, I mean, mast cell is a big thing these days. And to me, it's not always mast cell, it's just your immune system. Mast cells are the noisiest part, maybe, and the one that's, we're talking about. But it's the body's, persistent inflammatory state. And when some people are in that place, you know, herbs don't work because herbs, by their very nature, are stimulate herbs depend on your body's ability to get information and react to it. Okay. And if you cannot, and so many herbs are actually pro-inflammatory. Okay. And if your body's not, I mean, that's basically how they work. They kind of stimulate your nucleus, to produce anti-inflammatory things, but they do that by giving you little bits of inflammatory information, okay, in small amounts. Um, and if you can't put out the fire even a little bit, they don't work. I mean, it's I go my classic story of this is 20 something years ago. That's how I first really started working with Dr. Harris, with Steve. Um, was I had a patient who reacted to everything, and I kept getting more and more subtle. I mean, more and more subtle. More, I mean, like less and less, smaller doses, and we were, homeopathic things, and they just blew her up. She just legs were swelled. This was long before we understood anything about mast cell. This is like in the early 2000s, and um, and and she went to see Dr. Harris, and he put her on five oral antibiotics at the same time, and she got better.
Wow.
And we see this is because when the immune system gets super sensitive, herbs are too inflammatory. They have too much information. They make too much noise. And that's where, the drugs for mast cell will work better for some.
So,
Again,
Dr. Gordon, real quick, because we haven't really had this kind of a conversation with other doctors before, because we have these patients that come on this podcast and we hear these stories all the time on social media. I am so sensitive. I can't take one drop of, a 200 drop dose of cryptolepis. I can't take this one particular herb in isolation, and I flare up and my mind goes crazy and I'm inflamed and I'm in pain and I'm, all these crazy symptoms. Like, I can't do anything to get better because I can't even tolerate a drop. I'm so sensitive. I'm so inflamed. I have all this MCAS going on. And what you're articulating is, if that's happening and that's a pattern we're seeing with the patient population, then potentially we should shift from the herbal side, which is pro-inflammatory for these MCAS patients, and use pharmaceuticals, right? But can you tell us specifically what potential pharmaceuticals or drugs you'd recommend for this subset of the Lyme community that you're describing?
When, if you're, we start obviously with the mast cell stabilizers, the cromolyn, ketotifen, and try to work, or just, the Allegra, Zyrtec, Claritin, I mean, just
Yeah.
working through them. And, these people often need, unfortunately, to spend a little more money and get everything compounded because often it's the, as Dr. Afrin will tell the world, it's rarely, well, not, yeah, it's rarely the drug itself. It's usually what it's compound, what the so-called inner ingredients or the binders, the fillers that people are reacting to.
Yeah.
Um, and so those folks, yeah, usually who are super sensitive to herbs, it's because they're not they're just lost the ability to modulate the immune response. So when their NF kappa beta gets stimulated, I mean it just makes explosions in the system. So that things like you just have to use the drugs to quiet the immune response. And then oh, here's the thing is, and then start looking at your nutrients, because this is something
Yeah.
in working, the underlying nutrient imbalances have always intrigued me, and but we still don't have great ways of measuring them. We're getting better and better at it. Um, because what we measure in the blood, when we're just trying to measure nutrients, that's what's in the blood. It's often not what's in the tissue. So people can check and like they have plenty of magnesium, and manganese and molybdenum and all these trace minerals. But if you actually could check into the tissue itself, you find out that they're deficient. And when you don't have enough trace minerals, your B vitamins can't work. And if your B vitamins don't work, you don't make, you can't make people talk about NAD a lot, and how important that is for the energy and the energy production in your mitochondria. But well, if you don't have enough NAD, or if when you break down NAD, I mean, you can't replenish it, you just build up the NADH, you start getting to more and more pro-oxidant states, and that makes more inflammation. So in some of these people, it really goes back to trying to um, give them the right trace minerals and get them in the system. Because often when the gut's inflamed, we don't absorb trace minerals well. We have a mechanism that was see, okay, let me just step back for a minute if people don't understand.
Yeah. Please do.
Basically, your body, your immune system was designed or evolved in fighting acute infections. Okay, because that's what killed you. You know, 200, 500, 10,000 years ago, the acute infection is what killed you. Most people did, if you, and so that's what your immune system, that's what we evolved to really defend against, 100,000, million, few million years ago is the acute infection. And so one of the things we did is we starved, in that first week, you want to like starve the bugs of the nutrients that it needs. And a lot of them, like we know that Lyme needs molybdenum and most bugs need iron. So we have a chemical that our liver makes called hepcidin, which when we get inflamed goes up and turns off the mineral transporters in the gut. It doesn't shut them down completely, but it quiets them down so they don't absorb trace minerals very well. Now, for a week or 2 or 3 weeks, not a problem. But if this persists for a year, 2 years, 3 years, 5 years, 10 years, your system starts really being working not as well because when those trace minerals get low, like I said, almost, yeah, I think every one of your B vitamins requires a trace mineral to work with it in order to function, to make energy, because they're all part of the of how your body makes energy. And how you make glutathione, and I mean that just on the anti-inflammatory effect, glutathione, you need the right trace minerals for all of these things. So and that's something that is hard to measure. cleanly. There's a few labs, but none of them are perfect. And
Who
so,
who are
but
the few good labs that you recommend, Dr. Gordon?
well, in the past, we always use, SpectraCell or Cell Sciences does a pretty good job. The issue that we have is if your body's actually low in phosphorus, which is, phosphorus, which you make ATP with, those tests don't always give us a clear answer, just by the way they're done. Um, and we're looking, I've been starting to use something called oligoscan, which I'm still looking into because I have to admit I'm still trying to understand the science behind it because it's totally different animal. It uses light spectrophotometry to measure the amount of trace minerals. And I'm not a physicist, so I've always been it always sounded a little magical to me how it works, but I'm working with several people who really, who understand the science and say that it's, pretty accurate for what's happening inside the cell. But this is something that's in process, so
Hmm.
I want people to keep exploring. It's not that I have the final answer on it, but and one of the people I'm working with is this fellow Joshua Leask, who is from Australia, and he's a actually was an engineer but very bright fellow who was in the biohacking space, but always had an interest in biochemistry. Um, and he had an episode of chronic fatigue when he was young and has always paid attention to that space. And he's developed some really interesting ways of looking at this aspect of what we need to get the basic mechanisms back. Okay, because if we're lucky, and you've been sick, I said only for a few years, even if you're depleted, the body is so amazing that it can still come back. But people who've been sick for a long time, the reason they're often overreacting to things is because their nervous system is in such an uproar. They tend to go from feeling foggy and tired to feeling anxious and wired, and they flip back and forth between those two states, rather quickly. And he in his worldview, and again, this is something I'm exploring, so I'm not. I said I think it's a very good story, and I always emphasize that because people have to understand that our um, our understanding of how the body works is really far from complete. Okay. If it's we would yeah, we would think we would know a lot more, but we don't. And I think part of the problem is because we figured out how to save people from dying. You know, and then we got really interested in viruses and genetics, and a lot of basic work in biochemistry kind of fell by the wayside. Biochemistry was the world of medicine in the 50s, 60s, and 70s. But even by the 70s, the virus, it was all viruses. We were going to understand viruses, we were going to understand the world. And then in the late 80s and 90s, genetics the genes are going to give us the answer. And those of you who remember when the Genome Project was first finished, everybody thought, medicine was done. We were gonna get your genes, put them through the computer, and come out with like what's wrong with you. You know, um, so what the point I'm trying to make is that our basic understanding of biochemistry is not complete by any stretch. So that's why when I'm talking about Joshua's uh, way of looking at the body, I think it's the most exciting one I've heard. It fits in with my patron saint of smart people is Dr. Robert Navio, who people he's wrote about the cell danger response um, and he and Joshua's models actually overlap beautifully. They really fit. So I believe it, but I always want people to understand that these are stories. These are how we look at the body. They don't always necessarily give us all the answers, you know.
Right. But although they're stories, they're also based on science. They're just not fully flushed out yet, and they're still a work in progress, right? So these are
Exactly.
still tools that are very helpful.
Yeah,
I
I
mean,
want to be clear that they're the best we have. The reason I call them stories is because we have a tendency to lock into information as though especially when you're ill,
It's
you
the
know.
end all be all, and this is it. This is the thing that's going to get me, right? I follow you.
It's like, it's like the Sears story, like Dr. Shoemaker's work, who, Ritchie is somebody who I said I've worked with Ritchie since closely, well, I used to anyway, since like 2006. And, I respect what he's done for the community. Um, but people become, true believers, and they'll keep doing things that aren't, like, sort of like we're talking about with with people who believe in just the herbs, become true believers, and they keep doing things that don't work for far too long.
Right, they need to evolve, and I think we've seen this a couple of now, probably going back 5 years ago. The parasite cleanses were the thing everybody was doing, and then they weren't getting better, and they kept doing it, and some of them were getting sicker, and they kept doing it. And it's like, all right, that's a sign. You have to listen to your body. Just because that's the it thing in the chronic Lyme community doesn't mean it's the right thing for you, right? So I understand all that. But just to kind of summarize, all of these things regarding trace minerals and testing, and you mentioned some of the testing, and that all made sense. But these are foundational things that feed up to allowing the body to not be generating more inflammation than necessary, to not releasing more mast cells than necessary, to not overreacting the immune system. But they're hard to measure, and that's a foundational thing. If we understand, we can take better measures at a lower level to support the body's imbalances to better allow our immune systems to do what they were designed to do, which is heal and remove pathogens from our body and have a homeostasis state. It's kind of what you were saying, I think, in a nutshell. Is that fair?
Yeah, yeah, that
Okay.
that, that that's fair. But again, every step of the way, it can be more or less complicated, depending on the individual, you
Right.
know.
I,
Because yeah,
I have so many follow-up questions, but I just want to circle back because I took you down a road there, right? So you were working at the hospital, 12 years of doing family medicine, and you realized it was very rewarding with acute illness, but not so much with chronic illness, and there was a gap there. And that's when you kind of said you branched out to start your own,
yeah.
medical practice. And then it sounds like that's when you met Dr. Harris and started branching out in the Lyme world. Can you walk us
That's
through that transition in
those
your journey?
in there. Yeah, no, I started doing, just, treating chronic fatigue, and in those days, I had been following Jeff. I had, spent time with Jeff Bland in the 80s, and Leo Galland and a whole bunch of other, really smart people, who the Ken and Steve Bach. I mean, they were all working in upstate New York, or, kind of around that area. And, we'd have meetings, and I was learning, but they seemed kind of magical. But anyways, but in 92, I went off on my own. I started doing that. And I did a year of osteopathy, because I'd always noticed that, people got better with chiropractic. And, even though we were taught that's bad stuff, but it's because function, the structure, I'm gonna take another little
Please
left
do. Yeah.
second. Okay. Because that's my other, I think, most frustrating thing for me, is to get people to understand how important their body structure is to their, getting better. Okay. Because once you have an injury, doesn't matter if it was, you hurt your arm, you hurt your knee, you hurt your ankle, you heal. But lots of times you don't heal completely, but it doesn't matter. You're 99%, you're good. But that area often has a little reduced blood flow. The lymphatics aren't draining as well. But you go on, and you can live to 100 like that without a problem. But when you get a chronic inflammatory infectious disease, doesn't have to be infectious, but a chronic inflammation, because maybe it's just toxic load, um, then, those areas there's your body starts storing more and more junk in those areas of low circulation. Okay, and you're not getting it out. Okay, and many times, we'll have, your back is stiff. Well, especially in our modern culture, where people
Yeah.
don't move enough. We spend too much time in front of a computer, especially too much time leaning forward in front of the computer, with your head 6 inches in front of your
Are
neck, in
you
front of
calling me out? Are you personally calling me out? Not Dr. Gordon. I see what you're
no,
doing.
no, no, no. I think we all suffer from this, like, trying to keep your ears above your shoulder, instead of, like, anyway. But all of this puts stress on the connective tissue. Okay, and then these muscles in your neck get tight. Well, you get brain fog. Well, you're not draining your brain. We now talk about the lymphatics, but long before we knew about the lymphatics, we just knew that the lymph drainage. from your neck and your head isn't good when these muscles are tight because lymph and especially the lymphatics are low pressure systems. So, your blood vessels, your arteries have a lot of pressure behind them. Your veins have a moderate amount of pressure. So with that, even if there's a lot of tension in the muscles, the blood tends to get in and out fairly well. But the lymphatics are very low pressure system. So even a little increase in pressure, well, they don't drain well. And if they're not draining, then the garbage that's supposed to be removed from the tissues backs up and stays there. And you start making, and once you start getting inflammation going up in your body, well, those areas are places that will trigger local inflammation. And that causes more swelling and less drainage. So if we can, to getting people to realize that, a good, cranial osteopath or this now, much to the chagrin of the cranial of the doctors of osteopathy, there are many people who have other degrees who have studied osteopathy, and some of them are quite talented. So I no longer pardon me, osteopaths, but there are many people who have excellent hands, and there are so many different schools and ways of working with the body that can begin to improve the drainage. Because when that's better, there's less inflammation. And again, then there's less noise in the body. And so it's so important to take care of that. So anyway, so I did a year studying at the osteopathic school on Long Island. Um,
On Long Island? Where on
yeah,
Long Island?
well, I was living in upstate New York then, so I would just
Oh.
take the train down to the city and go out to the island, and I spent 2 days a week there for a year,
Where
and
was it on Long Island? Do you recall what city it was in?
it's in what Glen Cove, the New York
Glencoe.
College of Osteopathic Medicine. It's in I forget this, anyways, but right over
Yeah,
there.
small world.
And anyway, I never became the world's best, but I was good enough that I could help people. But now I tend to I send people to people who have better hands than I do because one of the things you'll notice, and especially if you're ill, that if you get work done on your body by somebody who is not used to working on sensitive people, you will flare. But don't run away from the treatment. It just means you need less because if you suddenly open up the tissue and you dump a bunch of toxins, just
Yep.
inflammatory chemicals, and your liver already is overwhelmed by the inflammation that it has to deal with from your gut, you're going to feel crappy. You're going to have an inflammatory flare. Your post-exertional malaise is going to go through the roof. Whatever pain you have, your brain fog is going to get worse, and you're going to go, "Oh, that's terrible. That's a horrible treatment." No, it was just too much for you at that moment. So you need to find someone who has a better appreciation of of people who are chronically ill because most people who work with these tools are working on athletes or weekend athletes or and who when you open things up they might get a little headache but the next day they feel wonderful. Unfortunately, when we open up in somebody who's been ill for a few years, they might feel sick for a week. So you just have to, it's not that, don't throw away the baby with the bathwater. I mean, just know that you have to use these tools in a more subtle way, but they will open your body up and let you heal easier. Again, the beauty of I keep coming back to the body is that you don't have to do anything perfectly. Okay. It's just like mood. Yes, yes. If you're someone who's optimistic and is full of love for the world, you tend to heal easier. But that's not a free ticket, because I know plenty of angry people who still get better. I always like to say, get this across that you don't have to do everything perfectly. So, but getting your body opened up will help quite a bit. So anyway, so I did that, blah, 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 and then I dropped out for my wife. I don't know, wanted me to retire at a young age, and we went to Mexico. But I came back and I worked with I met Neil Nathan at a course, and this is like 95 or something, and I went to work for Norm Shealy, where Neil was for a year.
And Neil
Uh,
Nathan is a mold, a prominent mold
yeah,
doctor,
well, yeah,
correct?
yeah, well, but
Yeah.
he he'd been in this world of interesting medicine for a long time, and Neil's quite an amazing human. And anyway, then I came to California, 97, 98. I moved to California, blah 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 blah, and I still didn't treat Lyme. I had a patient who got me interested in treating rheumatoid arthritis with antibiotics, and I was getting a little, but I didn't want to use antibiotics. I have to emphasize here, I was coming from that point that I really wanted to use natural things. I was leaving, I wanted to, fix your gut, fix your hormones, and get you on your way. This was I call functional medicine before we had functional medicine. We called it alternative medicine back in the 70s and 80s, and early 90s. You know, Jeff Jeff Bland named it, and I said Jeff was one of the people I learned a lot from in the 80s and early 90s. Um, but when I got here, I started to see more and more sensitive people because someone who was a specialist in multiple chemical sensitivities retired and kind of like his patients heard me on a podcast talking about mercury toxicity. I don't know how, or anyway, they all showed up. And I had to go down the rabbit hole of people who couldn't take anything. And then to fill it up in 2001, Wayne Anderson. I don't know, Wayne's just retired, but Wayne was a naturopath who had studied with Dr. Burrascano in the late 80s and early 90s because Wayne was working in what's called Occidental, which is a place in the Russian River in Marin County, no, in Sonoma County. Anyway, full of deer, full of Lyme, in a time when everybody insisted there was no Lyme in California.
So he was
Okay.
working with Burrascano out of Long Island because
Yeah,
he's a local Long Islander, Burrascano.
yeah, but
Yeah,
Joe, Dr. Burrascano was a man who's always dedicated himself to helping other doctors.
yeah.
Okay. And he was amazing. I mean, Wayne was on the phone with him. He said in the early 90s all the time, and like treating patients with Lyme because there's a lot of chronic Lyme. And it was untreated because we were told, I mean, in California, there was no Lyme disease, officially. And so Wayne joined my practice in 2001, and it just opened my eyes because I had all these patients. I had Dr. Norm Shealy, who I'd worked with in the mid 90s, was a neurosurgeon, and he specialized in chronic pain. And so I was doing a lot of chronic pain work at that time, and I had a bunch of patients who made no sense for the academic world of chronic pain because their pains moved around. Okay. And they had all this burning pain that, neuropathic stuff that, again, nobody made in the early 2000s, late 90s. It was just like, what? Crazy stuff. Well, some of Wayne's patients looked like my chronic pain patients, and I started to realize all these people with the very odd presentations of chronic pain had tick-borne disease. And that's when I went down the rabbit hole completely. And we started off, and of course, we did a lot of in those days, we did a lot of IV antibiotics, but in those first few years, we've realized that, it worked for a good percentage of people. It was great, but we had a lot of people who we were getting sicker, not better. They would be on, IV Rocephin and months and months and months, and they were getting sicker and sicker and sicker. And so, and we had always talked about Wayne being a naturopath about detox, but we were seduced by the antibiotics for a few years. And then we started working with detox. And, Byron, we had a very interesting office. Byron White, who just passed away,
Yeah.
unfortunately. Um, Byron developed, well, he came with his Babesia and Bartonella, but he developed a lot of his other formulas in our office. He worked, he sometimes much didn't see patients in our office, but we gave him a room for his lab. He and Wayne worked very closely together. He and Dr. Anderson worked very closely, and developed a lot of the formulas over the years because Wayne would test them and they go back and forth. And so we got more subtle. We started using a lot more herbs, and then we started using everything. And at the same time, I met Ritchie Shoemaker. Again, I met from a patient. Patients teach us most of the things. I had a
Yeah.
patient who read Ritchie's book, and I read it, and we met at a meeting, and when we had him up here, we did We did a 3-day Shoemaker for Dummies course back in 2000 and I don't know 10 or 14 or something. Anyway, so we had a lot of fun and we've learned a lot over the years. And no matter how much I learn, I still don't get everybody better. I mean, that's the problem. What people have to understand. This is a disease of the individual. Okay. So and what's frustrating is that you can do what works beautifully for one person doesn't do anything for the other because we keep needing to get to the individual level. And what's exciting, I mean, so exciting to me is that in the last years, 4, 5, 6 years, the testing has gotten better and better. Not just the testing for looking for the bugs, but the idea of looking at the genetics, the proteomics. Um, I said just the metabolomics, just all these things. We're getting more and more information now. And just the same thing with the stool test. We went from like, in the 90s, we were looking at 4 bugs in the stool test, and now you got 400. Um, so it's a lot of information, and that's our problem right now, is we have to make sense of all this information. And it's a lot, and I can't. I mean, I'm using lots of people as consultants now, people who like know more about one little piece than I do because it's just grown so much. This is where AI hopefully is going to be really helpful, is taking large amounts of information and giving us useful pieces, but it still requires the clinician to know how to use that piece in your body. And that's the thing is watching how you respond to treatment can often guide us through this minefield. Because, again, I want to be clear. The good thing about most people with Lyme disease is that they just really need to have their Lyme treated. Okay, I want to because I see a very uh not refined, but sort of like by the time people come to me, they failed lots and lots and lots of therapies. So
Right.
they're not they're not that's why it's so hard to get them better. But I just always like to remind people that thank God most people respond to herbs, antibiotics, mast cell therapy. Of course, in mold, I mean, the problem with mold is that if you don't get out of the mold, your symptoms aren't going to go away, and you're not going to know whether you treated the Lyme or not because
Right.
you're still feel terrible.
Dr. Gordon, but talk to us about that. Because you mentioned you worked with Dr. Shoemaker as well, who's the mold expert. What did you learn while doing all that work and research with him? Because we know that if you're exposed to mold and have mold toxicity, the treatments won't work. You're not going to get better. And oftentimes people waste their money and throw it away, not knowing mold is keeping them sick. And is that a full statement? Just tell us what you've learned and how you've learned to navigate it.
Um, yeah, yeah. Well, I think that's a true statement. I have seen it time and time again and people who insist that there's no mold in their homes and they have no mold exposure, and 2 years later, we finally get them to leave their home for a week and a bunch of symptoms clear,
Yeah.
you know. And the thing that's so frustrating is there's no good, this is where we need better testing. Okay. Mold testing, I still think is, urine mold tests. I mean, we do them. You've got, US Biotech now used to be real time, which is the ELISA test, and Mosaic, which used to be, um, I forgot all of a sudden, old man memory. They're different tests, by the way. I mean, I want people to realize one is one is an immune test, and one is a mass spec. So the mass spec measures the mycotoxin in your urine. The ELISA measures an immune response to the mycotoxin, but it can be bound or unbound. So it can be partially metabolized and will still be positive in the real time or US Biotech lab, where the mosaic just shows you the unbound mycotoxins. The problem with both of these tests is that most of the things they find, the levels vary from day to day, and if they're mildly elevated, I don't think they mean anything. I mean, if they're like 10 times above their limit of normal, I really think, it's probably something. But I still don't think they're great tests. And then we have the MyMyco test, which is a test that is an antibody test to the mycotoxin, okay, itself in your body. Like it's an antibody test looking for your body's antibodies. Okay, so when you expose to mycotoxins, you'll make antibodies against them, and the MyMyco measures the level of those antibodies. Their argument is these kind of antibodies should disappear within 3 to 6 months after you haven't been exposed. So if they're still there, you're still being exposed or you're colonized. I believe this clinically. I just want people to understand that conventional medicine doesn't really believe that yet. Okay, but it doesn't mean it's wrong. It just means that, I like people to understand that a, a lot of the things that we do, we're doing based on tests that have not been that well validated. I mean, what they're measuring is accurate. Okay, I want to be clear. Like these are clear approved. I mean, like when they're measuring something, but the meaning of that measurement is still not well validated by the quote unquote academic medical community, which doesn't stop me because they're often useless, but still understand that if you go to a conventional doctor with your urine mold tests, they're going to roll your eyes or insult you or one or
Yep.
the other.
We've heard that time and time again. People bring their tests to, their regular doctor, and it's like, nope, we're not taking IGenics. Nope, that's all garbage. We don't believe that. So yeah, that's a
I
problem.
want to be clear about it. See, IGenics has got well validated results for a long time. Okay, and they have popular. We've been uh, you know, and you know, yeah, you still have. I mean, the problem you still have is the question of normals. Because there are plenty of asymptomatic people can have IgG antibodies to these bugs because they were exposed and they got better. Because a lot of people get Lyme disease and their body takes care of it. I mean that's the other thing is that not every, just because you have Lyme, I mean you meet people, like the foresters, the guys who've had like, 1,000 tick bites in their lives, they all have Lyme. But
Yeah. Well, why do you
not,
think that is? Why do you think so many people can get bit by a tick and recover without any kind of drug or any kind of diagnosis with their immune system, and others become crippled and chronically ill? What is your thought on that?
it's just your immune system, and your level of see this, I should say just your immune system. It's probably the level of insults that you've and how your body has responded to them over your lifetime. Okay. What else is imbalanced? Um, if you're, and your nutrition and toxin load underneath it, because we often I mean, Dr. Parpia, one of the doctors, one of the naturopaths who works with me, and she has been, I mean, it's been, yeah, 12 years. And I've seen her results where she'll take the time, which being a regular, see, doctors, I always want things fast. But anyway, but she'll take the time and detox people for sometimes 2 years, okay, which is much longer than I have patience for. Um, and many times their Lyme will clear with sometimes with no treatment, okay, because their immune systems are now working normally. Now, I mean, that doesn't happen all the time, but I mean, people have been sick for a very long time. That's usually doesn't usually work quite that well, but it works often enough as proof of concept that it's real. You lower your toxin load, okay? You get the heavy metals out, and this day and age, just the garbage that we have in our systems. I mean, who knows with the microplastics, and nanoplastics, but I
Hmm.
mean, just and the thing is, to be fair, it helps to have a good diet, but we treat a lot of people who eat very cleanly. I mean, we're located in Marin County, which is like is strange place. But I mean, we have several supermarkets that are all organic. I mean, like way past Whole Foods garbage. I mean, like and people. I mean, you can get organic food in lots of restaurants here. I mean, it's a clean living place. Okay. Still plenty of toxic people. So it's the environment. It's so, I mean, that's the thing. Just breathing in is a problem.
But even the environment, we've seen people be exposed, right? Families, spouses, to the same toxins. And one person is crippled and one person is not. And when we look at the bodies and we go through these tests, we're seeing that, the wife may have detoxed and all the toxins are not in her body anymore, whereas the husband is chronically ill and is harboring all these toxins. So I do think it's something about our body's ability to identify and remove the toxins and all the chemicals in a healthier way than others. And some of us just do it better. And right, I think that's part of it.
Oh no, I think it's a huge part of it. I mean, this is the thing is that, I mean, it's we're becoming more sensitive than we used to be, and I
Yep.
think the diet is a big part of that. But yeah, it's the total that your being, okay, everything about you, like I said, from your structure, from your belief system, from your diet, from and the immune system you came in with, I mean, like and what it saw growing up. I mean, how many infections did it see? Did it see the infections? I mean, one of the biggest problems we have is probably we see infections at the wrong time. Okay. Epstein-Barr virus, most of the world gets Epstein EBV in that first year of life. We don't get EBV in America often until we're like 18, 19, or 20. And that's when we hit, that's why so many people, the last thing they did that ever had them 100% healthy was mono in college. I mean, they might recover, but they never go back 100%, a lot of
Why is
them.
that though? Why in other nations and parts of the world are they getting it earlier and recovering, but in the West we're getting it later in life and not recovering?
Your immune system learns. Okay. I mean, infections when you're young are how you learn. I mean, I mean, okay, I don't want to, I worry about our whole culture because kids don't play,
Yep.
kids don't wrestle enough. I mean, like, watch animals, watch how kids develop, how boys develop. They wrestle, they roll around, they do things. I mean, like, your immune system has the same thing. It has to meet infections and learn. And so many people live in these isolated we all single family houses, and the kids, I mean, like they have I mean, like not they don't have nannies, but if they don't go to daycare, they don't get exposed to a lot of viruses when they're young.
It's
And
sanitized. They're clean environments. I know what you mean.
yeah, and this is I mean, this is not, this is maybe fairly well defined because I mean, there've been a few natural experiments and a few times where there was a place in Finland that noticed that all the kids across the border in Russia didn't have any allergies, and all their kids had allergies, and all they did was let them play in real sandboxes in the school, and the allergy rates went way down, because
Yeah.
before they had all disinfected, but they had the kids play in real dirt, and lo and behold, less allergies. It's that simple. We need exposure to all these things at the right times in life to develop a really healthy immune system.
But
And
isn't it deeper than that, right? Because we've heard people say that antibiotic overuse by us and also our ancestors, our gut microbiome is far less diverse because of antibiotic use. And over time, when we inherit our microbiome from, our parents and our mother at birth, we're inheriting much less diverse microbiome. So when you look at somebody from 80 years ago compared to today, and if you were to compare their gut microbiome, they're drastically different because of the Western world, including antibiotic overuse, including the sterilization of our homes and our workplaces, right? But do you think
it's
that the last
huge.
100 years, including drug overuse, is contributing to this in
Oh
addition
yeah.
to just the sanitized world?
Oh yeah, yeah. Well, I mean, more importantly, in our use of antibiotics, because that's a big it's the use of antibiotics in the animals that are the problem. Okay. I mean, other than if the free living people, you can screw your microbiome up, but it's not. The problem is our animals are fed antibiotics daily. And you got 100 million cows and pigs and chickens that are fed, and that's what's producing this vast antibiotic destruction of the microbiome, I think.
Can you
Almost
elaborate on that? So what do you mean by that? Because I don't really I don't follow, and I think it's a really interesting point. Are you referring to like when we eat
Yeah.
the animal and it's and the antibiotics are in them and now we're consuming the antibiotics? Is that what you mean?
Yes, but also they are producing all kinds of bizarre bacteria, not bizarre, but bacterial resistance in the bacteria in the environment. Okay, because
Oh, so it's twofold that these all of these animals are being pumped with antibiotics to stay healthy so they can grow and then become food. But the pumping of antibiotics on a daily basis is resulting in antibiotic resistant bacteria that we never had before, infecting humans as well.
Right, right.
Okay.
But and our guts, are just the variation in food. I mean, like people tend to eat the same foods over and over again. We don't have seasonal diets. I mean, all these things do
Yep.
contribute. I mean, the thing we can say is that um our modern world is a beautiful thing, but is a deadly thing. I just came back. I just spent a few weeks in Brazil in southern Accra, in basically in the jungle, and those people, they don't have chairs, you know, which is a wonderful health thing. I mean, because the worst thing you can do is sit in, if you have to. I mean, you see people who are in their 70s and they're spry because their life consists, you're on the floor or you're upright, floor, upright, floor, upright.
Yep.
Look, it's like so simple, but hey, I'm in a chair right now. I mean, like it's we are weakening ourselves by our comforts. I mean, again, and I'm sitting in a chair too, so it's not that, but we have to like really rethink everyday life. And we can, I mean, that little things that are coming, like people with the zero balance shoes, so instead of having these big heels, which prevent the pumping mechanism of the arch, I mean, like there's so many ways that we are, destabilizing our bodies. The beautiful, I mean, the body is such a wonderful, complex system that it's able to keep compensating. But one of the lines I like is that people talk about root causes. Well, it's not so much a cause; it's the root compensation. How your body has adapted to a abnormal to an unnatural situation. Okay. And there we have, the fact that we walk in these shoes with like tons of padding. And so we never, our arches don't really, we don't pump. I mean, that's the beginning of pumping your lymph, is that foot flattening
Yeah.
and arching and flattening and arching.
But let me ask you a question. Do you think there is a root cause to chronic illness or chronic Lyme disease in patients? Because everything you're saying is it's all of the imbalances, it's all of the
Yeah.
compensation.
No,
Like you
there's
said,
no,
hey, if you had a healthy immune system, if your diet was healthier, hey, if you'd have the mold exposure, maybe your body could have handled Lyme. So is Lyme or the bacteria that causes Lyme disease or the tick bite really the root cause? Or is it all of the insults, all of the things that resulted you becoming chronically ill? Whereas if you didn't have, maybe four of them, your body could have handled it, right? What is your view on that?
oh, totally. Well, you see, this is this is the American viewpoint. I mean, it was based on bullets. Okay,
Yeah.
if you have a bullet wound, that was the cause. But if you had, but you did even there's there are very few bugs that you can be exposed to that your body can't handle. Okay, if it's healthy. Okay. I mean, even cholera. Lots of people survive cholera. I mean, it doesn't matter what the disease is, bubonic plague, it killed hundreds of thousands, but some people lived. I mean, so the body can handle these when it's working optimally. And that's the problem. Is it's different people have different issues that weaken them the most. Okay. For some people, it is the diet. For other people, it can be their emotional, their early childhood trauma. I mean, for some people, it could be EMFs. It depends what your body is most sensitive to. That's what makes this so hard, because it's your system, and
Right,
what.
but all of this knowledge and somebody with your specialty can help weed out each of these things, right? And you're very humble, Dr. Gordon, where you're like, hey, look, I don't know everything, but you know a lot. And you're going through all these things. And if you have this list of things that it could be and you're testing, some of it's going to be you feel your way through. Let's try this. That didn't work. So it's probably not that, right? You can kind of go through the list and eventually get somebody into a better place. And I get it's not a perfect science, and I get it's not always going to be perfect and it could be messy, but you have to be creative and you have to think outside the box because the chronic illness community has been failed by so many people. It's never going to be black and white, cut and dry, right? So I think that's something we have to recognize. But
Yeah, and I'll just say, and that's
yeah,
why we need better tests, because right now this is a disease for rich people.
yeah,
Okay, because these tests are expensive. The treatments go from moderate to very expensive, and it's like, and we don't know, and we're still playing pin the tail on the donkey, you know?
Right.
And
Right.
so what we need is, and we're getting to, I have this prayer that maybe, and I really think it's close, 1, 2 years, 3 years, depending how much money, as as we're being able to combine really advanced testing, AI, and clinical observation, because AI by itself gives you garbage for really complex people, but it can sift through a tremendous amount of information. Like I said, you give me like these new stool tests with, 100, 400 bugs. Well, a handful of people who really that's all they do can help you a lot. But if you're going to the average doctor, it's like, so that's where we need the AI to really help us. But again, the problem with the stool test is that the information feeding into the AI still kind of, well, sucks. It's not very
Right.
good yet, but
But it's only
it's
going to get better, right? And you
getting
see that at the
better.
basic level. People go to the doctor, they get basic blood work, and they feed it through AI, and they have better conclusions than what their doctor tells them. You see it on social media, right? They'll have AI interpret their blood results before they go to their primary care doctor. They go to their doctor. Their doctor says A, B, and C, and they go, "What about D, E, F, G?" Right? Because they know from AI, and the doctor goes, "What do you mean?" And they goes, "Oh yeah," and they missed it, right? Because we're human. So it's
Hey,
and that's at a basic level.
yeah, no, no, absolutely. I mean, like, I just happened the other day. I mean, somebody had an abnormal blood test, and like, yeah, it's an abnormal liver function test, and it was like my first thought was, oh, let's get an ultrasound of their liver, or whatever, and look at the drugs they're taking, and well, I didn't recognize that. Oh, but that one is more specific for muscle, and this person works out. So it was I mean, AI is so useful as a backup. It's just the problem when we think it doesn't know enough, because the old story from computer science, garbage in, garbage out. And
Yes,
that
sir.
is the problem. But, it as an adjunct, as a way to help the doctor, I think it's going to be amazing. And I just hope doctors have enough humility to realize how much we need it, because there's just too much to know. There's just too much to know, and you can't know it all. Um, I said I've been working on this for a lifetime now, and you forget. I mean, like, oh, just biochemical pathways. Unless you're using them, unless that's your specialty and that's all you're doing, can't remember them all. The
Right.
genetic pathways, you can't remember them all. So we can't pray that every doctor we see is an amazing genius. But what we can hope is that they know enough of physiology and understand enough about your body that when you give them a lot of data that's been, translated by AI, that's another data point that they can use to really help make it something that fits your body. Okay,
Yeah,
that
and
that's
I
that's the
couldn't agree
problem.
more. I couldn't agree more. But you keep touching on something I want to ask you about because earlier you just talked about the genetic pathways. Then you were talking about sensitivities to electromagnetic frequencies, and on the topic of mold too, and all these things. So we hear people say, "Hey, I have the MTHFR gene. I have the double MTHFR gene. I can't detox. I'm never going to get better." Hey, I have the HLA-DR, whatever gene, which is I think the mold gene, right? I'm never going to get better. Hey, I'm really sensitive to EMFs, and I'm never not going to be around cell towers or routers or wireless technology. I'm never going to get better. And some people really believe that, and then they don't try to do things to get better. Now, look, I do believe there's some validity to genes making you more susceptible to things, right? Because like the autoimmune thing is right. Genetics loads the gun, environment pulls the trigger. I think that's a pretty powerful statement. But the question is, what are your thoughts? Because our genes can be changed; they can be activated and deactivated, right? So we see that. But what is your thought on genetics when it comes to chronic illness, chronic Lyme? Which really chronic Lyme is not just Lyme disease; it's everything. If you're chronically ill for a wide variety of reasons, like we said, it's not just one root cause; it's many root causes, right? So, can you talk about genetics a little bit?
Genetics are not destiny. Okay. It's that simple. I mean, genetics are possibility. Okay. You can have, MTHFR. I mean, so many, I mean, put it like this. I mean, like, just I forget what Ritchie's things these days. I don't bother with it anymore. But HLA, I'm not the dreaded genotype, but I'm right below it, the 11 da 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 da. You know, and I had Bartonella 15 years ago. I still have a positive fish. I'm going to be 75, and I'm fine. Okay. I mean, like, these things are put. They're
You have a positive Bart fish, right? Is that what you just
Yeah.
said?
So I still have Bartonella, which I need to treat again. I had
But
to
you're
treat.
healthy and you're non-symptomatic.
I'm totally asymptomatic. I think, maybe my brain
No,
carries
you clearly are. You are a brilliant man. So, but
is
it's proof positive that just because you have a positive infection doesn't mean that your body can't even manage it, right? So, not that you shouldn't do more, maybe to, knowledge is power to make sure it doesn't eventually make you sick.
no,
But
no,
that's a
no,
powerful statement. So, I don't want to lose sight of that.
no, no. I just want to be clear. It's something I need to treat. It's just that I'm a like many men, I'm a terrible patient. I always say women are, I mean, so much better patients. Men are just impossible. They don't do anything. You tell them. My
Truth.
Uh, so, but that's just the proof is that no one test is your destiny. Okay. There are people who, there are very few single gene abnormalities or SNPs that create disease 100% of the time.
Right.
And even when they're there, the penetrance is different. What it looks like is different.
What does that mean? The penetrance is different. Can you
I
explain
mean,
that?
just like how it affects your body.
Hmm.
Okay. I mean, like, this is what got, I have to, unfortunately, I have to go in a minute, but this is what got Dr. Navio into metabolomics, into looking at the chemicals your body uses to communicate with itself, the small chemicals that go in and out of the nucleus and the mitochondria back and forth, because he was a professor of genetics. His specialty was inborn errors of metabolism. Those are these usually diseases have a lot to do with lipids that tend to kill children in the first 10 years of life. They're terrible illnesses. And his specialty, he was genetics. But he saw so many kids who had the same genes, but one died at 2 and one died at 8. I mean, like, and so it's not just,
Genetics are not your destiny. I love that.
I mean, you can see it with people with sickle cell. I mean, like, there are 20% of people with sickle cell who have terrible symptoms. 80%, don't do so bad. I mean, it's the same gene defect, but it's how your body is compensating. So, I mean, like, a lot of people come to me with they're null for I forget, one of the glutathione S transferases, and like, oh my God, I can't detox. I'm good. No,
Hmm.
you've got backup systems. You've got, it's not that it might not be a problem for you, but it's not your destiny. And I have a patient I just spoke to yesterday who I have tried for 8 years quietly to try to explain this to her, but she's just hooked. This is not going to change, and it's always, it's not going to change, but it's not your problem. I mean, it needs to be thought about. It needs to be, maybe we need to modify protocols. We need to support your
Hmm.
glutathione system, but it's not unfixable. MTHFR, the same thing. It's I mean, 50% of Ashkenazi Jews have an MTHFR SNP. They're not all sick. The thing is that a lot of Northern Europeans have much more trouble with the MTHR SNP because again, it's only in a fewer percent of the population. So there's less likely that the body has worked other workarounds because most of these SNPs have benefits. Okay.
Yep.
They can't, the reason they're high, they're in the population is because they protect you against some other problem. Okay. Like, just like sickle cell lowers your chance of having issues with malaria. I mean, like, thalassemia, the same thing. The malaria doesn't do as well in those cells. So, life is not simple. And this is getting back on my final point when I was trying to make it be earlier, and I don't think I finished. Single answers for chronic disease works rarely. I'm not saying never, because every once in a while somebody will find, oh, they'll take folinic acid and their whole life changes. Okay. So I don't want to say never, but almost all the time it's a lot of small steps. Because that's how you get sick. That's why your doctor doesn't understand you, because you have little bits of multiple things that we might call diseases if they became big. Okay. And and that's why doctors don't recognize you because they look at you and you got, but if they really went through your biochemistry, they would find that you've got a little well, you've got a moderate amount of inflammation in your gut probably, and and your liver doesn't detox this thing well, and your kidneys maybe have trouble holding, like, maybe your aldosterone isn't working well, one of the hormones that help control how you hold on to sodium and volume in your body, but none of them result into something. The levels never get to the, oh, this is a disease, because you need often things to be 10 times the upper limit of normal to really get a disease. But the systems, you have multiple dysfunctions. And if you've got multiple things that aren't working well, there can be multiplicative sometimes. Okay. And that's a different way of thinking about the body. And that's how we have to get there if we're really going to help chronically ill people. We have to like get away from like, I'm looking for the one thing that's wrong with you. And everybody wants that. And I don't blame them.
Yeah, because
That's,
people are desperate and they're suffering and they're miserable, but they
and
need to
that's,
know the truth. The truth is you can get better and there is
yes,
hope, but it's
there is.
not going to be one thing. And we have to take steps forward and work with a trained professional like yourself because, Rich and I come to the conclusion you can't do it on your own. Everybody says be your own doctor. And we think that's a little harmful because we are not trained specialists. And when we're sick, we certainly don't have the right mindset or the right ability to do that. And frankly, even a healthy person shouldn't. So we need to find the right partner like yourself, right? And if somebody like yourself and have the right mindset to approach. Now, I do know that we have a time crunch here, but I have two final questions that are quick questions for you, Dr. Gordon. The first one is, we barely scratched the surface. I would absolutely love to have you back for a follow-up. And Rich couldn't make it tonight because he got stuck at work, but we'd love to have you for a part two at some point in the new year. So that's my first question. And my second
Oh,
question is, how can people contact you and look to work with you if they resonated with this episode?
well, we have a website, gordonmedical.com, named after me. Yes. Little, and there's a little button somewhere that says become a new patient. And,
Yep.
you hit that. And we have two wonderful people, three wonderful people who will like answer your questions, let you know what you're in for, so no surprises, and just yeah, because we like people to know what's needed and what we expect. And what you said, people, I like patients who want to, be their own doctor up to a point, because your exploration, your intuition can often help, sift through this like multiple, oh, it could be a lot of different things. Well, obviously we want to narrow it down as quickly as we can to the few that look like are on top. And and often that's what you have to do is, you got to deal with the mold. You got to deal with sometimes the mast cell before the mold because but I mean mold, getting out of mold is just critical. I mean,
Yep.
I cannot tell you. It took me. I used to. I was not a early mold person because like many people, I'm not sensitive to mold, and that's the problem is that you have, families, only one person is sensitive to the mold. The rest of them go, oh, what's the big deal? Well, but it is devastating to the person who's sensitive. And again, in my little belief is that it took an earlier infection to upset your immune system because mold is so ubiquitous in our environments. We shouldn't be, I don't want to use the word shouldn't, but we shouldn't be sensitive to it. And usually we are because usually Lyme has changed your immune system because that's the thing. These chronic bugs change your immune system in order to make a better environment for them to live in. So you get into trouble. Anyway, it is so much fun to talk to you, Matt.
Yes.
I mean, it's because I want people to understand the thought process and
Yeah.
just get that you can get well, but it's if you're lucky, you're going to have the same kind of problem as the last 20 patients the doctor saw. But if you've been sick for a long time, there's a good chance it's not going to work out so nicely.
Yep, but there is hope and there is a path and there are steps and there are things we can do. So, Dr. Gordon, I can't thank you enough for coming on our Tick Boot Camp podcast. This episode is going to be launching in the new year. This is right before the holidays for everybody listening. This is going to be launching on January 10th. But we're going to definitely have to get you booked to come back because I think we could do another hour and a half of this easy, especially if we had Rich on. Frankly, I'm glad he wasn't here because I got you all to myself tonight. So can't thank you enough, Dr. Gordon. And, we will certainly have you back. And thank you for all the great information and sharing all this with our community.
Oh, my pleasure, Matt. And really, just thank you for doing the work you're doing because information is what patients need. That's what will give you some hope. Because if you're, I mean, if I can't imagine getting sick and like, where do I look? So having, shows like you, which give people a broad range of what's out there is so, so important. So really, thank you for the work.